Ready to dive into implied consent versus informed consent documents? Informed consent documents are a big part of any healthcare organization. These forms are meant to provide clear and thorough consent documents to their patients to sign. However, one study showed that the quality of the average form is quite low. So, how do you improve the quality of your informed consent forms? I'm Alex with Jotform, and in today's video, we'll gain a better understanding of implied consent versus informed consent and how to obtain written informed consent properly. Let's go. The main difference between implied and informed consent is legality. A patient calling your office to book an appointment is giving implied consent to receive treatment. Implied consent is informal, and the way a patient behaves will indicate whether or not they give you permission to do anything. Informed consent, on the other hand, is a legal term. There are 7 elements that make up informed consent, and if any of those elements aren't met, informed consent has not been reached. Before performing any medical procedures that are non-emergency, a healthcare provider has to receive informed consent. If a patient is a minor, a legal guardian has to give informed consent. These are the 7 elements required to make informed consent valid. First, the individual has to be competent and be able to understand what they're consenting to. A patient with dementia can't give informed consent. Second, the individual is making their decision voluntarily without anyone else forcing them to. Third, the patient must receive sufficient info in order to make their decision. For example, if someone with psoriasis is offered a topical cream and an oral medication that may compromise their immune system or have side effects, their healthcare provider must give them that information. Fourth, the individual must receive a recommended plan. For our psoriasis patient, this means their dermatologist has recommended they try the cream for 8 weeks. Fifth, the individual has to understand the terms being used in elements 3 and 4. Sixth, the individual has made a decision on their treatment. And seventh, the treatment plan is then authorized. In most cases, healthcare providers are required by law to gain informed consent. However, there are a few instances in which this isn't necessary. For one, there are some procedures like prescribing a simple course of antibiotics that don't require informed consent. Also, if delaying treatment because you're waiting for informed consent would actually result in irreparable harm or even death, informed consent isn't required. Let's say a patient was brought to the emergency room unconscious with a severely ruptured spleen. Instead of a physician trying to obtain informed consent from the unconscious patient, they can operate in order to save their life and lessen their injury. Those are just some of the instances in which you don't need informed consent. Otherwise, informed consent is absolutely necessary. Whether surgery, advanced medical tests, chemotherapy, most vaccines, or high-risk treatment, a patient must sign an informed consent form. Outside of in-person treatments, patients also have to sign informed consent forms for telemedicine visits. This is primarily for patients' safety and knowing their privacy rights when it comes to visits via telemedicine. There are a few steps when obtaining informed consent. First, you have to make sure the patient understands what they're agreeing to and that they've received an explanation. Second, you'll need written consent documented via a signed form. If you want an easy way to do this, look no further than Jotform's informed consent form template. You can customize this form to your practice and even have the patient sign it electronically. As far as procedure explanations go, you can create a template for various procedures that include their specific risks of treatment. Your written informed consent form should also include places to gather all of the patient's basic information. This means their name, address, date of birth, and medical history at the least. Also, adding a clause that states that the patient knows what they're agreeing to is key. As I mentioned, your patients can fill out all of this required information and sign electronically. Jotform's electronic widget makes it easy for the patient to complete their form before they visit the office. When gathering informed consent from patients, make sure it's easy for both them and your practice. With our tips, you'll have reliable informed consent at your fingertips. Let's review. Implied consent is an informal agreement. Informed consent, on the other hand, is legal consent required from a patient or guardian for certain surgeries, treatment plans, medical tests, and vaccines, among other things. When you obtain written informed consent, you must present the patient with all of the necessary information, as well as a clause stating that the patient is aware of what they are agreeing to and gain a signature from them. Thanks for tuning in. I'm Alex with Jotform, and I hope you're feeling a bit more informed about informed consent. See you.